Welcome to our latest episode of the Lebanese Physicians Podcast. واليوم رح نحكي عن from neurochemistry to cardio, how exercise can rewire your mood. والجست تبعنا اليوم هو دكتور فريد طليع. هو هلا he's been in the psychiatry department بالAUB for a very long time, and he's specialized in multiple areas of psychiatry. يعني بيخبرنا شوي عن حاله أكتر. بس في الشيء اللي نحكيه هو كان something as simple as walking or running through rival antidepressants. هلا بنحكي نسمع باخر الحلقه شويه. فريد، فيك تخبرنا شوي عن حالك? Can you introduce yourself a bit to us and what you do at AUB?
Thank you, Khalil, for inviting me to your podcast. And obviously, we go way back. We are good friends and kind of family friends. So I'm a psychiatrist. I studied at UB and then went to the US. I did my training in Cleveland Clinic. So I am certified, American board certified in psychiatry, sleep medicine, and addiction. Since 2012, I am at UBMC. And also I'm in the faculty of medicine, associate professor of medicine. I practice really in Lebanon mostly, and see patients online from all over. My interests are sleep medicine, addiction, and innovation and technology in psychiatry.
Yeah, which is a big actually innovation. مش هحكي عنها كتير اليوم, بس it's a big thing these days actually, especially social media وهيك اشياء for kids.
أكيد.
So بدي لك شغله. عم نشوف كثير massive umbrella هلا of randomized trials و neuroscientific trials, psychiatric trials. عم بشوفوا انه exercise reduces anxiety و depression وهيك اشياء. بابا نحكي عن هالشغله. So when did psychiatry begin recognizing exercise, I guess, as a therapeutic modality for patients?
In general, psychiatry is a relatively young field, لأنه it is really an offshoot of neurology. حتى some people might not be aware of Freud, the most famous or maybe the first psychiatrist, was really a neurologist. And he realized that some things were not obviously explained by traditional neurological science at that time. And he developed psychiatry/psychology. So relatively it's a new field. But if we go back, the father of American psychiatry, Benjamin Rush, around 1800, was one of the first psychiatrists who recommended occupational therapy and specific exercising for people who were hospitalized and had mental illness. So the first official recommendation, we can trace it back to around 1800. So it's been around for some time. But systematic studies really, in our modern scientific sense, did not start until the 1960s. في واحد اسمه Dr. Morgan, he pioneered most of the early modern studies.
It's exactly بلش وبعدين الستاديز. بس كمان what لانه نحكي دائما نحن انه serotonin receptor whatever SSRIs او SNRIs وكل هالاشياء for depression. بس what's the neurobiological pathway that explains exercises, I guess, anti-anxiety or antidepressant effects?
Okay, this is a very interesting topic, and there's lots of current research. Hello, we're not going to go into neuroscience and molecular biology, but actually you'll be surprised that the effects of exercise on mental health, improving depression and anxiety, are not mediated by the standard neurochemicals, serotonin and dopamine. Okay. The main factor seems to be something called BDNF, brain-derived neurotrophic factor. This is like fertilizer for your brain. BDNF makes your axons, dendrites, synapses more active, healthier. It makes your neurons more robust. And it can even promote some neurogenesis, which is very challenging. And one of the very few things that can increase BDNF is exercise. So BDNF can vitalize the brain activities which are hypofunctioning, يعني البعم يشتغلوا منيح in depression. So we know نحن انه depression and anxiety كمان at a higher level يعني beyond the psychological aspect are default brain network errors. So the brain is networking نحن عنا دايما. So when some parts of the network become disabled by مثلا high cortisol levels or extremely high مثلا maybe substances that are harmful, the brain connections fall apart. So BDNF activates these connections. Another proposed mechanism is lactate. انت I know you're a runner صح؟
Exactly.
So lactate هو اللي بيعمل لنا الكرامبس لما we exercise. Lactate is able to cross the blood-brain barrier and actually goes into your brain and stimulates NADH intracellularly and promotes BDNF. So the lactate from your muscles actually goes to your brain and has a positive effect. We also have more general benefits, reducing cortisol, moderating adrenaline levels, and there is a downstream effect on endorphins, on enkephalins اللي هن بيشبهوا natural opiates, make you feel good. يمكن الكونسبت of runner's high بيجي من هونيك. So in summary, these are the main mechanisms.
Exactly. كلمة whenever I do a long run أو شيء هيك you feel good for the whole day. تبلش قبل الشغل شو ما بتصير بالشغل بتصير تقول إنه it's like it's a good day. بس basically عم تقول لي إيه أنت إنه exercise actually mechanistically its effect on depression is different than antidepressants or CBT or other things that
Yes.
you use in psychiatry. So
لانه يعني this is also one of the challenges in psychiatry. يعني هلا في شوي innovation. هلا we have some atypical drugs, we have the psychedelics, we have the يعني حتى neuromodulation. نحن we do it also at يعني our clinics at EUB, including magnetic stimulation. So we're trying to have different things. But the bulk of the treatments are monoamine modulators, يعني serotonin, dopamine, and adrenaline. So things really are يعني SNRI هدول كلهم they are just different formulations. So for many decades you're limited to these things. So في recent research that shows that mild to moderate depression and anxiety can respond very well to physical activity, and they are at least non-inferior. يعني يمكن منهم أحسن بس منهم أقل فعالية من traditional medications that we use. وكمان therapy helps in general, most people. Therapy has been shown to be equivalent to exercise. If you do exercise and therapy together, probably you'll have additive effect. يعني it doesn't hurt أكيد. So we have very good robust research on numbers, and they're quite recent يعني من 2023 2024. So one study recent study showed يعني antidepressants had a 44% improvement rate, running 43. يعني very similar يعني.
بس هيدي in mild to medium depression مش
هلا نحن دائما يعني again يعني as a هيك public يعني disclaimer يعني when we talk about most of these studies يعني we're not dealing with يعني what we call نحن in our field SMI, serious mental illness. Okay, so many people have mild to moderate psychological distress, anxious, a little bit unhappy, maybe depressed, mild depression. But if you have, for example, severe depression and you are suicidal and you cannot function, يعني the problem is يعني you are unable to run. And we see this in some cases, people who neglect their mental health بيتركوا حالهم لا كتير أخير. أما if you've also developed alcoholism and you're intoxicated most of the time, and obviously you're not going to be able to. Or if you have a serious يعني neuropsychiatric disorder like schizophrenia or psychosis, it's going to be difficult. But for things which are relatively moderate to mild, هيدا our focus really. Again, as adjunct treatment to serious mental illness, أكيد sports helps. نحن on our inpatient unit, we have a physical therapist come every day. We do some group exercises, individual exercises. So definitely it always has يعني a place in treatment.
وهذا السؤال بخليني اسالك. So في ناس بيقولوا انه group exercise or actually studies are showing them saying group exercises مثل let's say if you're running on your own or you're playing tennis or soccer with a group, they may even have a more beneficial effect than individual exercises. هيدا مظبوط شيء ولا and
Yeah, I think
that is
it's
the
true
case why.
لأنه we know نحن كمان that one of the major issues هلا in mental health is loneliness. Loneliness is coming up again and again in research globally as a driver for depression and anxiety and isolation. So if you are doing a group exercise, and I have a bunch of people I play basketball with every week, and you become they might not be your best friends, but you have a place to like maybe socialize, maybe interact with others, and definitely it helps reduce isolation. Even going to a class, you might be motivated. A PT might motivate you more. Going to a gym, I think probably might be superior to just working out in your basement by yourself.
Right.
You might make a friend. You might chit chat with someone. Yani, definitely the added social interaction is a plus.
Exactly. So that's probably why that is. بس ليك اذا واحد راح على الجيم حكينا بالجيم اذا واحد راح على الجيم و like they do weight training every day versus somebody goes to the gym and does a treadmill, which is better?
هلا ليك, this is a tricky question and some people debate this topic very 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 intensely يعني. هلا they have different benefits I guess بالbig picture يعني. Maybe for aging some people feel انه muscle mass is very very important and يعني in terms of reducing frailty, fractures and metabolic benefits. Running definitely has its risks, fractures, falling. If people are older, maybe يعني, they have joint issues. But يعني, in general, for like the things we are talking about, depression and anxiety, and I believe any type of exercise helps, but probably aerobic exercising might be a little bit superior to weight training. Uh, some studies have shown that يعني, 10, 15 minutes, a couple of times a week even helps. يعني you don't have to go and run 5K or 10K كل يوم. And it just يعني if you just a brisk walk around your block might help. Walking your dog.
Yes, so basically I agree لانه probably كانت اللي عم تحكيها هيدي lactate production potentially is something that can help too in that case. طيب في ناس بيقولوا كمان there's some studies that show shorter lower intensity exercise works better for anxiety. ليش؟
I think the يعني هلا again يعني many of these يعني concepts are coming from the new research and the new research is صراحة شوي limited. So في يعني small studies, observational studies, في lots of issues. بس يعني if you want to extrapolate why ليش يمكن lower intensity might help for anxiety is that anxious people can get claustrophobic quickly, they can get restless quickly, and they already have a little bit of elevated adrenaline levels أصلا. So anxiety mechanistically is high adrenaline levels بلا trigger.
Right.
So if you increase your adrenaline levels very quickly for too long, you might trigger. And these people are hypersensitive للphysical cues. So the heart rate تبعهم might be confused عندهم انه هيدا طلع my heart rate لانه انا ركضت اما لانه انا خفت. So for these people maybe weight training might be better لانه you have less maybe some of these changes like shortness of breath or tachycardia. And you don't overactivate your sympathetic system. So maybe you can do interval training, I guess.
Yeah, exactly. So like short interval training so you don't activate your system as much. طيب إذا اجاك حدا عنده تنقول moderate depression or anxiety, would you right now, would you prescribe them exercise? Would you prescribe them a medication or would you do both?
هلا again يعني there's no يعني perfect answer and mental health care هلا the way we practice is يعني and how people should practice is individualized. So you have to take a detailed history مش بس symptoms لأن it's quick and easy to establish if somebody has depression or anxiety. But you have to see in what context does it exist. Psychosocial context كتير مهم، يعني وضعه الحياتي الاجتماعي العائلي. يعني I might see somebody who might not have the time, ability or resources to go to a gym. يعني we have to become mindful. أنا ما في يجي عندي حدا maybe underprivileged, has lots of issues, and tell him, well, you know what, I go play golf on the weekend, you should go play golf, you'll feel better. That is مثلا elitist, صح?
Exactly.
Or maybe go to a gym. Some people might not afford a gym membership. So you have to prescribe it in the context, but at the minimum, I tell people انه any physical activity. يعني عندنا بلبنان انه لو نزلنا على الدكانة وجبنا غرض ورجعنا, it's better than calling a delivery to bring you bread from the store. Simple stuff. إذا رايحين على المول صفوا سيارتكم شوي أبعد. مثلا we have like some older people in Lebanon living alone. In Lebanon is يعني we all know has become مثلا where we live in the cities, it's unpleasant. There is no infrastructure for walking. Sidewalks are not repaired. If you go on a sidewalk, the other day I was walking and يعني you know where we live in a relatively يعني let's say better area. A motorcycle zoomed on the sidewalk behind me, almost knocked me over, ضربني بالميرور تبعه. يعني you can't even walk on the sidewalk. And sometimes you get trapped on the sidewalk. You can't get off it لأنه it's blocked with cars and stuff. So these people مثلا I tell them, you know what, is there a mall next to you? مثلا maybe you can take a taxi cab to the mall and just walk in the mall. And try to like walk the whole mall. And for some older people, they feel unsafe walking on the street because of falling or risks or ما في light. So you have to be creative. Some Lebanese still live in relatively rural areas, so they're lucky. But again, they tell me والله بتضيع كله طلعات ونزلات بتعب أنا وحكيم ما في. So again, we don't have like maybe like in other places like rails or stairs. So if it's an older person, it's very challenging to prescribe them exercise. For young people, أكيد it's easier. But definitely يعني you have to gauge the overall situation. If you feel it's relatively serious, you can co-prescribe. You can say, you know what, I think this medicine will help you. But anyway, our medicines take 3-4 weeks to work. So maybe until the medicine works, start exercising. If you like it, you continue to exercise. If you come back and you're better, we can take you off the medicine and بنبلش بالnew lifestyle. So sometimes you have to be creative and look at combinations. And of course, some people are resistant. They say, I don't want to exercise. And then you have to also يعني, respect their
exactly and give them
decision.
the medicine that they need in that case. بس السؤال اللي قالي في probably studies showing additive effects like exercise plus medicine لأنه they're working
Yes,
on different
yes,
areas
yes,
of the brain.
yes. So definitely, يعني we always prescribe it. And it's getting part of our routine practice, like telling people to stop smoking. يعني
Right.
أنا psychiatrist يمكن موضوعي ما خصه بالsmoking, بس I ask all this history. And part of the recommendations as a physician also in general is to recommend trying to stop smoking.
Right.
Or if you are consuming too much caffeine. So
Right.
all these details are very important. بتعرف كمان also like dietary habits and all these things really play a role. People who are challenged with يعني weight gain, obesity, especially many of the psychiatric medications can cause metabolic changes. So people are afraid انه بينصح الدواء ما بينصح. So these people, you might also incentivize them. It might offset some of the weight gain.
Weight gain, exactly. وليك why did young adults some of the studies عم بشوفوا إنه young adults 18 to 30 year old like show the strongest improvement as opposed to maybe older patients?
I would say because older يعني older patients probably have less buy-in. يعني مثلا let's say we see people احنا هون in Lebanon in general, well, even when I was in the US, older people, for example, are more resistant to go to therapy. They prefer the medicalized model. Doctor patient أعطيني دواء بصح. So younger patients are more open مثلا to go to therapy. I think the same concept is for exercising that yani some older patients, especially if they've been suffering for a long time, it's hard to convince them in this lifestyle changes. And sometimes they're frustrated, they want a quick fix. But you can always yani, educate about it and put it out there, and hopefully it will resonate more. Young people are definitely more receptive to the exercise option, and many of them are active, and we can uh, يعني كمان incentivize them to be even more active. So it's challenging for the older people صراحة. Oh, plus, like we mentioned earlier, maybe the access, feasibility, in Lebanon في cultural issues, like if you're an older person, you might feel odd going to the gym.
مظبوط.
يعني في كمان our cultural biases. I'm sure انت when you go to the gym in the US or you come to the gym here in Lebanon, you see the population is different. يعني نحن here people are very conscious of what others think of them, appearance, feel lots of shame, and so they might feel uncomfortable.
ايه هون actually دايما بقول لسمر لو my wife هون يعني مثل جارنا he's an older person, he's like 80 something years old, وكل يوم he goes like cycling و swimming وهيك. قلت لها like older people in Lebanon never do this, like you never see an older person
يعني
in Lebanon.
if I tell my dad انه يلا go cycle, he's gonna tell me انه people بيضحكوا علي.
exactly.
يعني so this is cultural.
ايه بس I think it's changing. I think حتى بلبنان
ايه
probably
it
with the
is changing.
older
And again
generation.
as again يعني ايه يعني مثل ما بنقول هلا احنا انه 60 is like 40, 40 is like 20.
exactly. طب ليك في بتشوف pregnant women بيكونوا they exercise and they
One
start.
angle هلا one angle هلا
Uh,
هيك about older men that works مرات is to tell them about the positive effects on libido and their performance.
that's a good one.
ايه and that motivates some people يعني especially people who have ED and such things. Then definitely exercise helps. And it
exactly.
does increase testosterone levels and when your muscle mass increases. So هيدا الانجل عن بعض الاشخاص بشجعهم.
Exactly. I think it's a good angle لأنه it not only improves their mood, it also improves
إيه.
other things, which is a which is a cycle. ما هي كمان لأنه this could improve their mood too. They
اكيد.
have وهي بتجيني على قصة الليبيدو دي. Pregnancy. So basically, pregnant woman is exercising, whatever. She gets pregnant, she gets to 8, 9 months pregnant, she stops. But then sometimes postpartum depression hits. So in the شو بتقول, what's the role of exercise, I guess, during pregnancy and post-pregnancy to prevent postpartum depression or to treat it?
هلا يعني obviously يعني the peripartum period يعني just before and just after pregnancy are very challenging for most females. هلا اكيد نحن we don't want to pathologize pregnancy. يعني it's a natural state and we don't want to pathologize the situation. But definitely postpartum depression is an issue. And what limits are allowed for pregnant women, definitely exercise is helpful. هلا بالpostpartum where we have most of the issues, أكيد exercise helps. But again, there are some يعني challenges مرات, breastfeeding, the pain, if you did a C-section. But you can also prescribe simple physical activity, stretching, yoga-like things. Definitely, يعني these at low intensity, but they're better than nothing. But it also can help offset the issues with weight and body size and body image post-pregnancy in women.
Yeah, which is great, exactly. So السؤال الثاني اللي عندي لك هو السايكايتري جايد لاينز، لانه probably في كتير misconception او conception عند العالم when you go to a psychiatrist you get a medication, right? Psychiatry guidelines for depression, anxiety, wait, do they mention, I'm sure they do, but do they mention exercise as part of the prescriptions, I guess, for these diseases? And where is
Yes,
it mentioned in the algorithm?
formally in England, the NICE protocols هلا now recommend it for patients and it is in the manual. So if you deem انه the serious مثل ما قلنا منه SMI يعني serious mental illness, you are يعني obligated to prescribe it. In the US it's not so clear, but I would safely assume that most reasonable and يعني well-trained psychiatrists should be able to recognize this as a modality and offer it and يعني support it and يعني validate it for patients.
طب like what research gaps I guess still exist in terms of this field?
هلا research I think is long-term research. Most of these are relatively short-term studies. It also has to be about يعني بنرجع يعني yesterday I was talking to giving a lecture at our public health department, and we were discussing some new modalities like the psychedelics وهيك. The research in the psychedelics is mostly around one يعني 85-90% is in one demographic, basically middle class Caucasians living in the US. So we don't know how these psychedelics might affect marginalized people or other communities. And this is the same for exercise. Most exercise mental health research is from Western European countries. So there are different cultural aspects, different economic aspects. يعني again, يعني luxury, يعني exercise is a luxury.
Right, right.
We live in a world now where unfortunately healthy living is a luxury. So you can get high quality calories, but you pay a price. You can get lots of low quality calories for cheap.
Exactly.
So يعني, some people have multiple jobs. So the concept of كمان يعني privilege. So as psychiatrists, كمان we have to be aware of that, or physicians in general. So يعني some patients you can tell them, go to rehab. Some people they can't. Some people can afford to do massage and get yoga instructor and go to fancy gyms. So you have to tailor your response. But it doesn't mean that if we feel somebody is underprivileged or marginalized, we don't bring it up. And maybe we help them find out and know in their world, in their setting, what is the minimal feasible physical activity we can do. So we don't want to be like elitist
Right,
and
right.
يلا go train for a marathon and you'll feel better. It takes lots of resources and time, and we have to look at يعني كمان equity in healthcare.
Exactly, exactly. انا بتصير معي كتير actually مثلك يعني it happens to me a lot with smoking cessation. Like a patient comes in, I tell them, why don't you quit smoking وهيك بس هلا I know it لانه بتقولوا لك مثلا والله my son was shot last week whatever, I can't quit right now. So you have to take it into consideration and these people are living under a huge amount of stress and you're not living it
So
yourself.
يعني at least harm reduction يعني بس talking about the stuff and telling them طب when you are ready I will help you. Or يعني كمان انت you obviously deal with patients as much as I do. يعني 90% of most doctor visits are counseling.
Right, exactly.
So يعني people need autonomy and ownership. يعني you have to in your approach let them own it and then help them get to the goal. انه مش well not to shame people. انا بقول لهم يا اخي اذا فينا نمشي 5 دقائق يوم ايه يوم لا بيصيروا يضحكوا. بقول لهم طيب do it for me and tell me about it next time. And they actually come والله مشينا حكيم 5 دقائق يوم ايه يوم لا and we start pushing it.
Yeah, and then you push it like 10 days, why not يعني. بس ليك before as we get closer to the end بدي اسالك انت you're in addiction medicine. Is there a
Yes.
role for exercise in addiction medicine? Somebody is addicted to cocaine, heroin, stuff like that. Is there a role for exercise?
هلا يعني for addiction medicine يعني it highly depends on the substance and the severity. So نحن هلا we يعني in our field we use the term substance use disorder. It could be any substance. Criteria: mild, moderate, and severe. If you have a severe substance use disorder, exercise is very hard to implement and you're impaired most of the time.
Exactly.
But if you are in recovery or you have a mild case, definitely exercise helps by increasing dopamine, by increasing adrenaline levels, by helping you come in regulate your sleep. ما بدنا ننسى the effect of exercise on sleep. And so definitely it plays a role. and in يعني the major rehabs like rehabs مثل الناس بتشوفهم بالافلام بتروح تقعد شهر شهرين ثلاثه they all incorporate physical activity.
That's part of it.
Swimming ما حكينا كثير عن swimming. يعني aqua gym is fun for some older adults and safe, but again it's not accessible to everyone.
Exactly, ما هيدي it's the same thing.
Right.
هدول rehabs اللي عم نحكي عنهم كمان they're probably not
Right.
accessible to everyone. They're accessible to only people who have the money and the means to do it.
Yes.
If you could change one thing in psychiatric care tomorrow, what would it be?
اوف هذا سؤال كبير. يعني I would أنا like to move away from some of the rigid models عنا إياها and focus more on individualized care. ما نوقع بالtrap of هيك processing people quickly, ticking boxes for diagnoses and being very هيك rigid. So we need to نحن first understand the person. We are treating the person مش the symptoms. You have to look at the biopsychosocial situation. You have to prescribe meaningful therapies. If you tell this person this is an antidepressant يلا خذوا دواء بصح, they're not gonna buy it. So if you take a minute to tell them what the medicine does, they understand it more, بخف stigma. And what I like to focus on is يعني changing the concept from diagnosing to a more fluid structure where we reduce symptoms that are bothering people and improve functionality. لأنه في كتير ناس مرات we're not improving their functionality, and then the functionality issue brings back the mental health problem. And sometimes كمان as a psychiatrist you have to guide people. إنه your problem is not here. It's not going to be fixed with the medicine or exercise even. It might be يعني this issue at home that needs to be addressed, and now we're just fixing the symptoms. So يعني, and I hope that يعني neuromodulation and يعني new techniques which maybe are not necessarily just medication based and are easy to implement are maybe coming in the future. Maybe things like miniaturized neuromodulation. I read an article very recently today that their deep brain stimulation, the surgery used for Parkinsonism, is showing promise in schizophrenia models. And schizophrenia is a very frustrating and debilitating disease, and we don't have any cure for it. Things that happening like Neuralink and all these things. But again, يعني في line of brain-machine interface and augmentation, and يعني كيف بنصير cyborgs أما بنصير enhanced. يعني again, it's a spectrum. Yesterday, I saw one of my first cases of AI-induced psychosis in Lebanon. I wrote a brief about it on my LinkedIn. It was quite impressive يعني. And we were hearing about it, but it's definitely يعني it's becoming and it's somebody Lebanese, but يعني we thought this was يعني maybe like a circumscribed to maybe North America هلا. But
Exactly.
obviously it's spreading and everybody has access to the internet.
Right. So how does it? We're getting out of topic, but how did it happen? AI-induced psychosis, actually. What?
Part of it is يعني the way AI is built. يعني there are obviously lots of experimental work that show that you can nudge it by repeated corrections response to coincide, and it has built in what we call psychophony. Psychophony is a term where you appease somebody a lot. يعني مثل الشاعر البلاط. يعني where you يعني if you notice anything you chat you be wow what a great. يعني if you ask it يعني شو التاير pressure على my wheels, wow what a great question. يعني if you ask something mundane.
Exactly.
So it's built in to be pleasant, it's like having a personal assistant who thinks you're great وبده يرضيك. So if your brain becomes disturbed, you develop delusions or psychosis, you're isolated, and you are asking maybe ChatGPT about your symptoms, and you argue, and let's say I'm delusional people believe things are true. So, and if I tell them, no, I think Dr. Khalil is sending me brainwaves through the internet during this podcast to ما بعرف, affect something, and I ask ChatGPT, and ChatGPT says no. I tell them no, Bala, I know it's true because and then ChatGPT will start slowly going along, and then might start endorsing, and then it might start telling me, and Dr. Khalil, we have to avoid him, and he is the source of your misery, and this is the case where this kid in the US, I think, killed himself.
Right, exactly.
And somebody maybe assaulted somebody else. The person I saw is isolated. And probably there was isolated people who had developed severe depression can develop psychosis. So probably when the psychosis developed and the person was using ChatGPT, maybe initially to help themselves, it took on a life of its own.
Exactly.
And when challenged with the family, the person would show them, ChatGPT is saying they are wrong.
ما هو الشغله بتصير انا معك لان when you start using ChatGPT, a lot of times we're using it for like similar reasons, and with time it starts adapting to what you're asking it. Oh, you're not at risk of having AI induced psychosis.
Yeah. So definitely people are drawn more and more into their internal worlds, which كمان عم بيعمل problem of desocialization.
Right.
People lose some of their social skills, anxiety بتزيد, when you become desocialized, you become less empathetic. This actually might be possibly maybe some of the triggers for some of the mass shootings, and where when you are desocialized and isolated, you dehumanize others. You see people as hostile and objects, not as beings.
Right.
And then once somebody is dehumanized, it's easier to inflict violence on them.
Right. Exactly. Farid, this was a great podcast, and I think hopefully people learned about the effects of actually, مش بس exercise, I think individualized therapy for people, and you have to look at the social aspects, their economic status, what's available to them, what's not available to them, and then tailor your treatment options based on that. But the important part is exercise, remove socialization, and treat the person, not the condition itself.
والاشياء ما بتلغي بعضها, so it's not all or none. And أكيد نحن we don't want to demonize or scare people from medications.
Right.
They are extremely effective, safe, and have very good results. أكيد نحن we encourage rational prescribing, but definitely كمان we don't want to ما بدنا at the end the message to be the medications are bad and don't take them.
Yeah.
Okay, so we have to have a complementary approach, and thanks for inviting me, and there's very interesting questions. I enjoyed our discussion.
Thank you. I learned a lot from you. Again, I'm gonna focus on your point in the
احنا بنميزك ولا
medications are still very important actually in the treatment, وهن عملية complementary للexercise, not like exercise so far is going to replace the medications. All right, thank you very much.
Okay, يلا have a nice weekend.
Thank you, you too.
سلم على سمر
يلا.
البنات.
Bye.
باي.